Hello, my name is Erica York, RN, and this is my capstone and 5-year plan for Nursing 4580, Synthesis of Professional Nursing at Lamar University, Dr. Nancy McAfee, PhD RN, and Mr. Troy Palmer, MSN RN. My professional biosketch. My name is Erica York, and I'm a registered nurse, soon to be completing my baccalaureate degree this May 2019 from Lamar University. I have been a nurse since 1998. I started my career as a licensed vocational nurse, also known as an LVN, and began working in medical surgical nursing, where I learned many great skills from wonderful preceptors and mentors for 7 years before going back to San Jacinto College and completing an LVN to RN transition program, where I earned an RN associate's degree in 2006. I continued to work in medical surgical nursing, step down, telemetry, gynecological care, clinic care, home health, intermediate care for another year before transitioning to women's health in 2008, where I have been for the past 11 years. I have always loved to work with new mothers and infants, and I really enjoy my work. I am currently working as an assistant nurse manager on a charge nurse on a large mother baby unit in Houston, Texas, and have certifications in BLS, NRP, and STABLE. Learning outcome number 1, humanity and society construct. Practice is safe and effective holistic patient-centered care to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. Nursing 4316 Comprehensive Holistic Health Assessment. This outcome was met by researching and completing the Healthy People assignment. This assignment helped me to become familiar with multiple global health initiatives, but especially for breastfeeding mothers, and how a professional nurse will use the most recent evidence and research to support mothers and infants from birth and beyond. Nursing 4540, Nursing Practice Care Communities. This objective was met by doing the Practicum Window Survey and the Disaster Planning Project. I was able to interview community members while assisting them in developing a community disaster plan. The community was diverse and multicultural, and I was able to help families develop actual plans which were realistic to them and which fit their individual family needs. This objective was met at 95%. Learning outcome number 2, Lifespan Health Continuum Construct. Supports patients and clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Nursing 4620, Nursing Practice, Compromised Multiple Health States. This learning outcome was met through the community-based learning project on gestational diabetes. I research resources in the community that educate and support a pregnant mother with gestational diabetes. I was able to interview the pregnant mother, attending a support group which aids in the promotion and wellness as well as maintenance of the disease during and after the birth of the baby. This objective was met at 97%. Learning outcome number 3, Lifespan and Continuum Construct. Evaluates the patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. Nursing 4620, Nursing Practice, Compromised Multiple Health States, and Nursing 4316, Comprehensive Holistic Health Assessment. In 4620, the learning outcome was met by participation in multiple group discussions and the 4 practicum reflections on compromised health states. I interviewed clients with pre-existing health conditions, then assisted them with goal setting by listening, explaining, and applying various nursing theories. In 4316, I felt this objective was met by completing the assessments of the virtual patients during the virtual concept labs. The patients ranged in age and had multiple health problems, which required not only a physical assessment, but a review of the patient's lifestyle and culture, which help to provide safe and effective care. This objective was met at 97%. Learning outcome number 4, evidence-based practice and clinical reasoning construct. Synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. Nursing 4390, nursing inquiry and evidence-based practice. We did a qualitative article critique on a research study. I did mine on MI patients or myocardial infarction patients and nurse-patient communication. Using research and evidence to evaluate how patients perceive communication after having a MI and how they process the information they receive and the stress they may feel helped me to learn how to improve the nurse-patient communication dynamic. This objective was met at 91%. Learning outcome number 5, patient and client-centered care. Employ safe, effective patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and intraprofessional healthcare team. Nursing 4321, nursing theories and online education. We did a focused insight and essay question assignment. Here, I reflected on situations encountered with multiple patients, then applied theories based on the patient's needs. This allowed me to reflect on how a professional nurse uses theory application to work with other members of the healthcare team, and then assist patients with behavior or lifestyle modifications through support and education. This goal was met at 93%. Learning outcome number 6, professional roles and construct. Differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and clients as a member of the interprofessional and intraprofessional healthcare team. Nursing 4321, nursing theories and online education, and nursing 4550, leadership and management in the healthcare system. This outcome was met by the assignment examining differentiate essential competencies on legal and ethical responsibilities of a BSN nurse versus an ADN nurse. The paper helped me to explore the accountability that a professional nurse has and the importance of observing the Texas Nurse Practice Act. In 4550, the leadership styles paper helped me to examine my personal leadership style and what it encompasses to be in a leadership position. And I think it really helped to improve the position that I have now as an assistant nurse manager. This objective was met at 96% and 100%. Learning outcome number 7, professional roles construct. Demonstrates professional integrity, effective communication, active inquiry, and service to the community. In Nursing 4540, nursing practice care of communities, we did a project teaching plan and a project video assignment. So I met this learning outcome through assessment of the community members, through communication and observation, and also did a lot of research to find out what would fit the needs of a family with very low income to prepare an actual disaster plan. We also did a civic pride and diversity assignment. I volunteered within a multicultural community, and I chose to volunteer with the Houston Food Bank and was able to see how professional integrity really plays out in the community through the volunteering that I did. This objective was met at 95%. My 5-year plan is this year in 2019 to complete my baccalaureate program at Lamar University. In 2020, I would like to obtain my maternal newborn certification through NCC. In 2021, I would like to enroll in the Master's of Nursing Education program at Lamar University. In 2023, I would like to complete my master's degree in nursing education, and in 2024, to specialize in women's health education and pursue a teaching position within a nursing program. My references are as follows: Lamar University, National Certification Corporation, and Texas Board of Nursing, Nurse Practice Act. Thank you and have a good evening.